Hello, Irvington. Welcome to Health Matters with Dr. Griffith. I am the director of the health department here in Irvington and developed this show with the residents in mind. The goal of the show is to present health-related topics to all of the residents in a less traditional format. So today, I'd like to introduce to you the first guest of the show. Her name is Vadehi Dave, and Vadehi is from Essex Regional, so I'd like to introduce her and have her tell a little bit about herself as well as the organization that she's affiliated with.
Hi Irvington residents, my name is Vadehi Dave. I want to thank you Dr. Griffith for inviting me on the show. A little bit about Essex Regional. We are a consortium of 13 member municipalities in Essex County. I, in my role as the epidemiologist, serve all of our member municipalities in terms of communicable disease investigation, follow-up. We monitor health trends throughout the community and work on various emergency preparedness activities.
Great. One of the reasons why we invited Ms. Dave to come on the show is because we've received a lot of questions about the Zika virus. We know that there are multiple residents that are concerned about contracting Zika or the possibility of contracting Zika, and the weather's getting warmer.
Right.
So we thought that it was important for us to share some information with you so that you're equipped, you're well informed, and you'll be able to move forward with the steps that we discussed today. So I'd like to start first by just identifying what Zika is. So can you explain that to the residents?
Sure. Zika is a viral infection that is caused by mainly through bite of an infected mosquitoes. It can also spread when an infected man has sex with his partners. Outbreaks typically occur in Southeast Asia and tropical Africa. In May 2015, Brazil reported first outbreak of Zika in Americas. Currently the Zika has been present in many countries and territories.
Okay. So it is contagious.
It is not contagious per se, however, it is mainly through the bite of an infected mosquitoes. Again, the man who is infected can spread the Zika infection through sex to his partners.
Okay.
There is a possibility of Zika infection transmission through blood transfusion as well.
Okay. How likely is that? Do you know?
It is very less likely because so far there have been one report
Okay.
of possible spread of Zika infection through blood transfusion.
Okay. How severe is the illness associated with Zika?
Most people do not develop symptoms. In 20% of the cases, the illness is usually mild. The biggest concern to public health right now is the chance of developing a serious birth defect if pregnant woman becomes infected with Zika.
Okay. So we know that in town we have some residents who've expressed the concern about mosquitoes because there may be pools of water or stagnant water which has in the past attracted mosquitoes. So how concerned should residents be about those conditions?
At this point, anyone who's living in or traveling to area with ongoing transmission of Zika should try to avoid mosquito bites. And if they were traveling to countries that has ongoing transmission of Zika, they should try to avoid having any kind of exposure or mosquito bites for 3 weeks once they return.
Okay. Are there specific signs or symptoms associated with the virus that the residents should look for?
The most common symptoms include fever, rash, joint pain, and other symptoms may include headache, muscles pain, and red eyes.
Okay. Is there a vaccine for Zika? We know that there are vaccines out there for a lot of things. Sometimes we might get a vaccine for the flu, right? People get flu shots, but what about Zika?
At present, there is no vaccine for Zika infection.
Okay.
However, I know that there has been a lot of research that is ongoing in terms of, considering to make Zika vaccine.
Okay. So it sounds like prevention might be the most effective method.
That's the best way right now.
Okay.
Mhm.
So what we'll do is we'll take a break right now, and when we come back, we'll talk a little bit more about what the residents can actually do to prevent
Right.
mosquito bites. And in the first part of the show, we spoke a little bit about the Zika virus. We explained what it was. We discussed signs and symptoms of the Zika virus. But now, I just want to transition a little bit because I'm a little bit curious as to the prevalence of Zika in the U.S. and in New Jersey, because we do have a lot of residents that are concerned about contracting the virus, and I think it would be helpful for them also to know if there have been any identified cases in the U.S. or Jersey specifically.
Right. At present, we have cases reported in the state of New Jersey, but they're all travel-related cases. Okay. I do want to make emphasis on travel-related cases versus locally transmitted cases. We do not have any locally acquired transmission of Zika infection in the state of New Jersey. Okay. Although the mosquitoes that carry Zika infection, Aedes aegypti, Aedes albopictus, are present in other states. There is a possibility that we may see local transmission, but again, it would be similar to what we've seen with other mosquito-borne like dengue and chikungunya. As many of you may know, the New Jersey had identified their first case of Zika infection back in December of 2015 from a Bergen County woman who actually traveled to Colombia. Okay. In February of 2016, the New Jersey actually had diagnosed the second confirmed case of Zika infection in a woman who had traveled to Honduras. So as I said, we have seen travel-related cases in the state of New Jersey, but we have not had any local transmission so far.
Which means that there are as of now, no mosquitoes currently that exist within New Jersey that have transmitted the virus to any residents within the state.
Correct.
And the main individuals who contracted the virus have traveled to other locations, possibly contracted it there, and then returned home.
Right. And you pointed out, really a major point about the transmission of Zika is that in order for Zika to be transmitted and to have a local transmission in the community, the mosquitoes have to be infected with Zika first, and then they have to bite a person, to actually transmit the Zika infection. Or someone who has traveled to countries where ongoing Zika transmission is taking place has to come here, and the mosquitoes has to bite that individual in order to transmit the Zika infection.
Which we haven't experienced as of yet, or as of today, we haven't experienced that within the state.
Right. However, New Jersey Department of Health has been working with healthcare agencies and the health department to increase the awareness of risk of Zika infection for the travelers and the pregnant women.
Okay. And that makes sense because there is a travel alert, right? So a lot of times we've heard, or over the past several months, we've heard a lot about the Zika virus as the weather's changing as well. Right. We've heard about travel, we've heard about the virus. So can you explain a little bit about the travel alert and why the CDC might have issued the alert?
Right. The CDC actually has been updating their guidance in terms of travel advisory on a regular basis. To date, there have been 40 countries that have been affected by Zika transmission. Matter of fact, anyone who's traveling to affected countries like Caribbean or South America, they should actually look at the list of countries, which is on the CDC website. The CDC website is www.cdc.gov, and anyone can actually just click on that site to get the updated list of countries that are impacted.
Okay. So let's say they are traveling to the Caribbean because it's summer, right? School's about to end.
Everyone wants to travel.
Everyone wants to travel. Right? Or they might even have family from the Caribbean coming into the States, right? So what can our residents do to protect themselves?
Well, the best thing to do is make sure that you are controlling the breeding sites of mosquitoes in the community or, in your resident area. So there are ways to actually control the mosquito breeding site, because once the larvae becomes the adult mosquitoes, it's hard to control and it's hard to actually prevent mosquito population. So the best way to control is to wear long sleeves, protect yourself, make sure you have insect repellent with the ingredients that are approved by the CDC, like DEET, picardin, oil of lemon eucalyptus. I believe there's another one which is SR3535. You can, if you're actually planning to travel to those countries that have ongoing Zika transmission, make sure that you're using bed nets. If you're planning to sleep outdoors, make sure you stay in air conditioning room and use window screens to prevent mosquito bites. So there are ways you can actually avoid mosquito bites and make sure that you're actually controlling mosquito breeding sites around your home.
Okay. So just to review that a little bit, if somebody was traveling to the Caribbean, then they have the option of wearing long sleeves, which I don't know how many people are going to want to do, right? But if they don't wear long sleeves when they're overseas, they can use insect repellent, but not just any insect repellent, right? You would have to use insect repellent that has specific ingredients in them that are approved by the CDC or the EPA, right? And protects you from contracting the Zika virus. And that list also can be found on the CDC's website.
CDC and the State Health website.
And the State Department of Health. So again, the CDC website is www.cdc.gov, and then you can search for the New Jersey Department of Health. On their website, they also will have a list of the ingredients to look for when you're purchasing insect repellent, whether you're traveling overseas or even staying in state, right?
Exactly.
Because as the weather gets warmer, people start shedding clothes, wearing tank tops, shorts, things like that. So they can also utilize insect repellent here.
Correct.
So now you were talking a little bit about managing the breeding grounds locally.
Right.
And you were talking about stagnant water. Can we go into that a little bit?
Yeah, sure. We actually can try to control the breeding sites by avoiding, still water, in your residential area. So may that be your pool, abandoned pool likely to obviously have a, home to larvae like mosquitoes, which can actually form into adult mosquitoes. And now you have actually, a bigger population of mosquitoes in your community. So again, the stagnant water, should be avoided from the properties. If you can try to control that, then that would actually control the breeding of mosquitoes.
Right. So stagnant water can also be found in other places, right, around the house, not just a pool or a pond, right? If they have watering cans, right?
It could be buckets, it could be sandbox. I mean, it could be a lot of different things.
Any place where water sits.
Right.
Okay. So now we know a little bit about what residents can do to protect themselves. We spoke a little bit about stagnant water, and we also spoke about how residents might be able to protect themselves using insect repellent. Is there a particular time of day that the residents should be a little more vigilant, when either monitoring mosquitoes or looking to protect themselves?
The mosquitoes that carry Zika virus, they're very aggressive daytime biters as well, so they can bite during the daytime or nighttime. So anytime you're outdoors, you want to take steps to prevent mosquito bites. And again, as we mentioned about using insect repellent, wearing long sleeve shirts, those are the prevention steps you can take to control the mosquito bites.
Right. And outside of the homes and the properties, we mentioned that water, if it's sitting in a bucket, if it's sitting in a watering can, if it's sitting in a pool or a pond or any large body of water, right, it needs to be circulated. Right. So if the water is in a pot, it should be thrown out after a period of time to prevent that stagnation and also to prevent it from attracting any mosquitoes. We spoke a little bit about also the need for screens,
Mm-hmm.
right? So if residents have screens on their windows or screens on their doors that have holes in them, they should probably patch them,
Right.
right? To
Yeah.
prevent mosquitoes from coming into the house.
Mm-hmm.
Now, if residents are inside the house, those are things that residents can do if they're on the exterior of their
Correct.
house. But what about inside? Let's say a resident is in an apartment
Mm-hmm.
and they, check their windows and the screens are intact.
Right.
What else might they do? If we're saying that they shouldn't necessarily open the windows
Right.
or they should monitor how often they open the windows,
Right.
what should they do?
Well, if they are living in an area where the mosquito population is high, then they should obviously try to close the windows. Again, as I said, the mosquitoes that carry Zika infection are daytime biters as well, so they can obviously come indoor as well. So you want to obviously take any steps that can, prevent the mosquitoes coming into your apartment or house.
And then use air conditioning if it's available.
Correct.
Air conditioning, fans,
Mm-hmm.
to stay cool.
Right.
Right. Okay. Now, what about testing? Is it possible for the residents to test for the Zika virus?
At this time, the testing is available through the state health department. However, if anyone is eligible for testing, then they should actually be consulted with the New Jersey Department of Health. In case if anyone has any question about their risk and the exposure, they can contact the local health department. So in this case, Irvington residents should contact the Irvington Health Department for proper guidance. And the Irvington Health Department would reach out to the New Jersey Department of Health to see if the resident is eligible for being tested. At this time, I believe the State Health Department has adopted the CDC guidance in terms of pregnant women, asymptomatic or symptomatic, if they have traveled to an areas with ongoing Zika transmission, can be eligible for tested based on the primary care physician's guidance. So I would also consult your primary care physician if you are concerned about concerned that you were exposed.
Right. Is there anything else that pertains to the Zika virus that you believe our residents should know?
At this time, I would just advise all the residents that they should try to prevent the mosquito bites. If they're planning to travel outside of, outside in the areas where the Zika transmission is ongoing, you obviously want to make sure that you have insect repellent, you're wearing long sleeves. Again, the key is to prevent mosquito bites. And once you do travel to those countries, make sure that you actually prevent mosquito bites for at least 3 weeks after you return. If you're pregnant, make sure that you consult your primary care physician before your travel and after your travel, just to make sure that you and your baby is protected.
Great. I'd like to thank Mrs. Vadehi Dave from Essex Regional Health Commission for your participation and for sharing this information with the residents. Again, we know that some residents have been concerned about contracting the Zika virus, so this has been certainly helpful. Please remember that a lot of the information or all of the information that's shared is for informational purposes only. If you have any specific questions, certainly feel free to contact the local health department. I, again, am Dr. Griffith, the Director of the Health Department here in Irvington. So you can feel free to contact me directly at 973-399-6647. If you are looking or seeking additional information on the virus, you can certainly visit the State Department of Health's website, or you can visit the CDC's website at www.cdc.gov. So I look forward to spending time with you again as we continue to present health-related topics that are of concern or interest to the Irvington residents in the future. Thank you.